The birth of a new baby should be an exciting time for any family. Unfortunately, that is not always the case. Almost a third of new parents would describe their birth as traumatic. This is in large part due to something called obstetric violence. The World Health Organization has said every person has the right to the highest attainable standard of care, which includes the right to dignified, respectful health care throughout pregnancy and childbirth, as well as the right to be free from violence and discrimination. This statement may sound like common sense to you, but unfortunately, it is not the reality for too many birthing people. Obstetric violence is an umbrella term that covers any kind of abuse a pregnant person may face while they are receiving care. It is any kind of behavior that violates the person's human rights, legal rights, consent, bodily autonomy, sexuality, and dignity. This type of abuse comes in many forms, all of which are damaging to a birthing person. Obstetric abuse can come from any care provider, such as doctors, nurses, anesthesiologists, and even midwives. It happens in all types of care facilities, from hospitals, clinics, birth centers, and at home. There are a wide range of behaviors that could be considered obstetric violence. We're going to touch on a few here. The most characteristic and noticeable example of obstetric violence is any kind of physical abuse towards the birthing person. Moving from this, there is also undignified care, which includes things like verbal abuse, degradation, and humiliation. On top of this, there is also non-consensual care, which includes performing procedures like episiotomies and C-sections and the use of delivery instruments like forceps without the consent of the birthing person. These are often done under threats of harm to the patient or baby. These forms are probably the most blatant forms of abuse seen in obstetric violence. However, this, unfortunately, is far from all of the forms obstetric violence can take. Things like non-confidential care, which is when a provider collects patient information within earshot of other patients, and discrimination of any kind are both considered forms of obstetric violence. Lastly, we have abandonment of care and detention in a facility. Abandonment of care is when a care provider, for any reason, refuses to attend to one of their patients or they fail to intervene in a life-threatening situation. Detention in a facility occurs when a birthing person is prevented from leaving the facility they gave birth in, or their baby is kept in the facility for any non-medical reason. This reason is often failure to pay a bill. However, it is also used as a threat to get birthing people to agree to unwanted interventions. No matter what form it takes, obstetric violence is a violation of basic human rights and can have detrimental consequences on a birthing person and their family. Experiencing obstetric violence can have long-lasting negative effects. People who have experienced obstetric violence report leaving their birth feeling betrayed by their care providers. Many had long-lasting trauma that required years of therapy, and some experienced postpartum PTSD. These birthing people describe being plagued with flashbacks and nightmares of their birth, struggling with dissociation, and feelings of being brushed off by family and care providers when they question what had happened. Oftentimes, when people with PTSD reflect on their birth, they experience heightened levels of anger, depression, and anxiety, as well as isolation. It is also not uncommon for parents who experienced a traumatic birth to distance themselves from their new baby as they become a trigger for their trauma. This can understandably have a detrimental effect on the development of a relationship with their baby. Now that we know what obstetric violence is and its detrimental effects, we must ask ourselves, what can be done? The best way to address this issue is at the source, the care providers. Firstly, addressing obstetric violence during medical education will make future care providers aware of the issue and how they can handle it. To demonstrate this, let's look at a real-life example of a medical student dealing with obstetric violence. Paul was a fourth-year medical student who traveled to another country for a rotation in obstetrics and gynecology. Before arriving, one of his friends warned him about the violence he may encounter on the labor floor. This spurred Paul to do some of his own research, and he became familiar with the term obstetric violence. One day, while he was working in the hospital, he witnessed a resident yelling at a patient who had been pushing for hours. He was threatening her with an episiotomy and a C-section, all while degrading her and calling her weak for taking so long to deliver her baby. Paul was horrified by this behavior and immediately knew it was wrong. However, he didn't know what he should do. On the one hand, he could have stepped up right in the room and called the resident out on their behavior. Since the resident was already hostile, he was worried challenging him would only escalate the situation and could make it worse for the patient. Also, he was not fully aware of the culture in this country, and he did not want to be culturally insensitive. An alternative to this could have been to offer up supportive care for the woman. Research has shown that birthing people who receive supportive care are much less likely to experience mistreatment. This option would have been more likely to be viewed favorably by the resident, as it would not have been directly criticizing the care he was providing. Another solution to this problem would be institutional support for medical students. They need to be better prepared for situations like this so they are better able to identify cases of abuse and what the best way to intervene is and how they should report this behavior. Now that we've looked at how to create better medical professionals from the start, what can existing medical professionals do to help combat this issue? To learn more about this, we spoke to Kate McDonald, who's the founder of the Obstetric Justice Project, and here's what she had to say. Medical professionals should address obstetric violence by taking ownership over the fact that they are participating in obstetric violence and are complicit in obstetric violence, whether they intend to cause harm or not. We cannot end obstetric violence unless medical professions recognize the issue, call one another in, and stop doing it. It will take self-reflection, letting go of defensiveness and ego, discomfort, and courage to stand up and say that something is not right, especially when all of their training has conditioned them to believe that the current reality of care is normal and acceptable. All in all, medical professionals need to hold themselves accountable and educate themselves to be able to make the critical changes necessary to end obstetric violence. Now that we've talked about what medical professionals can do, let's take some time and talk about some actions others can take to work towards ending obstetric violence. In 2015, the World Health Organization released a statement which detailed steps that could be taken to end obstetric violence globally. First, we need greater support for research from governments and other development partners. More research is needed in order to measure the prevalence of this abuse, as well as understanding the effects on birthing people. This could lead to better implementation of more effective interventions. They also suggest implementation of programs designed to better obstetric care. These types of programs would support care providers in changing their behavior, the clinical environment, and health systems to ensure birthing people are receiving respectful quality obstetric care. Going along with this, they recommend that there needs to be more emphasis on the rights of the birthing person to dignified and respectful care. Advocacy in this area will help bring awareness to help ensure all obstetric care is meeting the human rights standard. Next, they talk about professional support and ensuring that all care providers receive support and training to make sure that they are giving quality care. Finally, they discuss how the process for ending obstetric care must be inclusive. There are a number of organizations that exist to provide helpful information to aid both pregnant people and medical professionals. These resources include the Obstetric Justice Project, Birth Trauma Ontario, and Evidence-Based Birth. Evidence-Based Birth is a company that has its mission set on global health initiatives, working to help birth workers gain helpful skills and evidence-based practices needed to protect birth givers. The group provides accurate information to empower the prenatal, birth, and postpartum experience for birthing people. They provide free online articles, podcasts, and classes which aid in the childbearing process, and they also offer resources for birthing professionals such as continuing education classes regarding providing evidence-based care. The Obstetric Justice Project is a Canadian company and a patient advocacy initiative working to address obstetric violence across Canada. They provide a safe space for patients, families, and professionals to share their experiences with obstetric violence, as well as a directory of where to direct complaints and reports of obstetric violence in Canada. They offer peer support for those working towards filing a complaint, as well as workshops for clinical education events. Birth Trauma Ontario advocates for birthing families and professionals working towards bringing systemic change to the obstetric care system. They offer a private Facebook group for survivors of obstetric violence to share experiences and help break the isolation that is so often felt. They offer information on the rights of birthing parents as well as childbirth education so parents are able to go into birth to make informed decisions. For birth professionals, they offer evidence-based information on providing trauma-informed care and breaking the cycle of obstetric violence. On top of this, they offer a professional course on trauma-informed care. At the end of this course, a person will have knowledge of what defines a traumatic birth, postpartum PTSD, obstetric violence, and more. Upon completion, they receive a certificate of completion and will be able to take their newfound knowledge and use it in their practice. This video is only the tip of the iceberg. Please check out some of the resources linked in the description to learn more about obstetric violence and advocacy against it. I hope you've learned something that you didn't know before and will take this knowledge and help work towards ending obstetric violence for good. Thank you.